I'm Dr. Gagi Roy Goswami. In Indian Academy for Clinical and Dental Genetics, we talk about dental genetics, we talk about genomics, biotechnology, molecular biology related to different fields of dentistry and also clinical medical sciences. So I'd like to discuss with you and share with you why we are focusing on such interdisciplinary scientific knowledge. First of all, Um, in today's date, we have so much of information with us. The plethora of knowledge today we have in hand after the completion of the Human Genome Project enable us to understand the genetic aspects of disease and also to generate novel approaches to prevent, diagnose, and manage diseases. Now, this new knowledge has created new imperatives for basic science and clinical education in medicine as well as in dentistry. The knowledge of genetics, genomics, biotechnology, and molecular biology and their applications have long been practiced in medicine. If you see altogether in that way, and we all know about it. But the dental world is still in dark, particularly when I talk about Indian dentistry, and that's really unfortunate. To ensure any meaningful application of, for that matter, any new discoveries for preventing disease or with a focus to improve clinical outcomes, it is very, very important, I feel, that the role of a professional workforce armed with leading edge knowledge is the most important key to contemporary practice and education. Also of equal importance is growing evidence of the dentist's role in recognizing not only dental and oral disorders, but also systemic indicators of genetic disorders, making us, that is the dentists, integral to the overall health and well-being of patients. Hence, I feel the only pathway to revolutionize Indian dentistry is to walk through dental genetics and its applications in routine clinical practice. Coming to our point of discussion, why are here we all together? Why are we going to teach dental genetics? Well, it is not unknown that dental disorders such as caries, periodontal disease, oral cancer, absent or malformed teeth, and any other common oral diseases have a very strong contribution of hereditary factors. This is becoming evident in dentistry as well as implications of systemic genetic diseases on oral health care. I feel now it's time that dentists should be prepared to discuss genetic factors as well as genetics tests for susceptibility to common oral health concerns and structural orofacial anomalies and the impact of genetic disorders on oral health. So for that, an improved understanding of genetic susceptibility, lifestyle and oral health risk factors allows a family's dentist to offer effective preventive and treatment strategies for oral diseases. So it's becoming increasingly important for dental practitioners to understand human genetics and to carefully select and apply genetic information to diagnosis and treatment of patients, and that's quite obvious. Dental professionals, we have actually a very unique opportunity to observe the development of pre-adolescent and adolescent patients during periods when important growth and development changes occur. In contrast to a general physician, dentists get a chance to screen many children for routine dental care on mostly on a biannual basis, regardless whatever their health status is. I think you will agree with that because dentists deal with the face and mouth. We can be the most skilled to observe anomalies which might be suggestive of major developmental malformations. Another important aspect to throw light on and to explain why to teach dental genetics is that we dental practitioners are aware of all the environmental and behavioral risk factors that contribute to poor oral health. So, With thorough understanding of dental genetics, these factors can be specifically identified. Tests can be performed to identify those at risk, thus helping practitioners to educate patients about the importance of their behavior and suggest preventive strategies to individual patients. That means even we are coming down to a point of personalized medicine, which is the call of the hour and need of the hour. Oral health professionals need to be prepared to answer questions the patients ask to them and also know where to refer a patient for additional information or counseling. For all these things, a basic understanding of the genetics of human disease, knowledge of the types of genetic testing available, and sensitivity to family concerns is required. So, I think that science is never a discrete thing, and so not is dentistry. So, dental genetics focus to an interdisciplinary approach towards the understanding of oral scenario, both normal and pathological. At present time, what we all know that there is a huge gap between the understanding of basic sciences and clinical sciences. My aim is to serve as a bridge to this gap. So, I envision to train and bring out dental geneticists, clinical biotechnologists, and dental entrepreneurs and implement genetic technologies in routine clinical and dental practice. Thank you.